for today's session was to go over OTPS, and also wanted to tack on to that family reimbursed respite and hiring of family members. So those three things, plus a discussion on EVV, which is electronic visit verification. So those are that's kind of the agenda for today. And then obviously if you guys have any questions, just let me know. If you'd like to, you know, if I'm talking and you want to just use the chat, Faye and Jen are available, and you know they can answer your questions. So there's no problem there. Okay. All right. So let me share my screen. Okay. Sorry, give me 1 second. Okay, so what I wanted to start off talking about was OTPS. So I know you guys know OTPS, I'm sure, but you know sometimes it's helpful just to review the categories in case there's something that you know comes to your mind that you want to tap into. But OTPS, you know, the majority of the self-direction plan is funded through Medicaid, which is a portion state and a portion of federal dollars. There are some things within the that the federal government in the waiver would not allow federal funds to be used for. So the state's approach to that was to create OTPS, which is 100% state-funded items for those things that were not Medicaid fundable. Okay, and it stands for other than personal services. Okay, and for this category, there's anything that can be approved has to pass all 4 of the tests here. So this is similar to IDGS. There's certain criteria. Has to be related to a valued outcome in the person's plan. Has to increase independence and or health and safety. And it cannot be an excluded item, and I'll go through that as well. And it can't be funded through any other source. So these are the 4 things we're going to look for when you bring forth an item in this category. And we did create a justification form that basically we took these 4 elements and put it onto a template that your broker or you can complete just to identify the answers to these 4 questions. And we'll just put that in the file in eVero, so that if there's an audit, we have that documentation there. And again, that's just for things moving forward, and typically just for things that fit into the last 2 categories, because there's 2 categories here that are a little bit vague and up to interpretation. So we'll go through that. Okay, so when they say other resources must be explored and exhausted, you know, for example, cell phones are made available, and I did want to share with you, oops, here it is, Assurance Wireless. So for those of you who don't know, a good resource for individuals that have are Medicaid eligible or get SSI benefits, so have that meet the criteria for the income levels, you can apply for Assurance Wireless. So it's just assurancewireless.com. And it comes with free unlimited calls, text, and an extra 20 gigabytes of free data each month. So this is the website here. So again, I know, and they have a smartphone, which they didn't always have, so I know that was a barrier, but that's here. So if for whatever reason you look at this and you say, you know, maybe the particular phone that they're giving out isn't going to be able to work, or whatever the justification is, you know, you could use the OTPS. But some families, because again, it's only $3,000 in this entire category here, if you could save a little money by getting a cell phone like that. So I just wanted to share that as a resource for those of you who don't know about it. Okay, so phone service, cell phone, and or landline. Many people have family plans. So let's say you're a family of 4 and you have a family plan on the phone bill, we're going to want you to identify the cost for your son or daughter or yourself. So, if the phone is $200 and it's $50 each person on the family plan, you would indicate $50. Even though the bill is going to say $200, you would indicate $50 as the individual share. Okay, internet. So internet can be covered if it's part of like a triple play package or something. The state won't reimburse for cable, so you would just have to identify the cost of the internet on that bundle. And oftentimes we do see bills that kind of, even though it's one amount, they'll kind of parse out each cost, and you'll have to circle that or identify. You make sure it's clear what is the cost for the internet. Okay, and the same thing applies if it's if it's multiple people using the internet in the household. It would be a percentage of based on the people in the home. Okay, the third one is software related to a person's disability, and software actually includes apps, mobile applications. So we've seen, as an example, I saw somebody submit for Seize Alert app because they got an Apple Watch, and the Seize Alert app would help to notify a family member if there was any seizure activity, would monitor those signs. So the cost of that could be funded here under software related to the person's disability. That was an example. Okay, staff activity fees. So this is for self-hired staff only, and this would cover meals, admissions, and fees, transportation, or other costs incurred by staff when providing support. So most of the staff transportation, we would encourage, put that in IDGS, because we can also pay for staff transportation in that category, and there's more funds available there. But here, what we see a lot of are admissions tickets or fees to different things. So if let's say, going to the museum or to the zoo, the cost of your loved one's ticket we could not pay for, but the cost of the staff's ticket could be covered here. I wanted to point out on the portal, sorry, let me just log in. I just wanted to draw your attention to, on the portal, there is an option for staff to indicate the staff activity fees. So like how you see this here, the staff can see this. You would just have to let Jennifer, any one of us know, and we could go ahead and enable the, we had to set the staff up as a vendor so that they could get reimbursed directly for those fees. But we do know that many of you lay out the funds and then you get reimbursed yourself. So there's two options for that, for staff activity fees and for transportation. The staff can submit it, and get reimbursed directly if they're set up as a vendor, or you can and get reimbursed yourself. Either way, you would have to, if the staff did submit it, you would have to approve that. Okay. Staff advertising and recruitment costs. A lot of people do take advantage of some of the services out there to find staff. So you might be charged a fee to put a posting in Indeed, or some sort of online service that requires a fee, and you could get reimbursed for that. Okay, this other one about costs associated with staff time for planning or training meetings, that has to do with the if they are exceeding the hourly limit of service. We haven't had to use that yet. We would reach out to you if that was an ongoing need. And then personal use transportation. So this is often for those things that, IDGS transportation covers service related. So service related is when your loved one is with staff, or they're going to some sort of service that's paid for through the budget. Anything else would come in here. So, there might be, maybe you live in a separate place from your son or daughter, and they come and visit you and they're taking the train, the cost of that ticket would be personal use transportation. Okay. Clothing can be reimbursed. This is, within this entire section, there's a total overall cap of $3,000. This one line item, clothing, is capped at $250. Okay, so even if you wanted to put the total $3,000 there, you couldn't. And this can be, again, anything. There's no limitation. It's just up to $250 worth of clothing. Okay, a board stipend would be food. So let's say, good example would be, and again, person has to have been denied for food stamps, or maybe, let's say the $200 of food stamps, or whatever the amount is not sufficient to cover the needs. So we have somebody who was using Insure supplements, and it cost about $150 a month. It wasn't covered by Medicaid, and the food stamps wasn't enough. So again, we would just require that documentation, and we could, you can go ahead and utilize that line. Okay. Then the last two, I'm sorry, go ahead.
I just wrote in the chat. So I'm just curious about that. I don't do that, but I mean, it says denied or not enough. So if you only got, like Ryan gets $16. Because
why is that?
Well, because he was originally getting like the max, and then we had to recertify once, and then we had to put in all his wages.
Oh, okay, yeah, it is income.
And so that screwed us basically. And I mean, now he's not even working, but that's besides the point. I mean,
you should reapply. Yeah, you should reapply if he's not.
I will if he, if something happens and he doesn't really go back, I guess that's true. But he is getting, I don't know if you know this, like if you don't get the max now because of the pandemic, you get an extra, he's been getting 178 extra every month, which is good. Yeah. I'm just saying, my point being though, that's a good point too though, about reapplying if,
yeah.
Whatever.
I mean, I think in that situation, the reason that he's not getting the full amount of food stamps is because he has the wages. So probably if you would want to if you would want to look into the board stipend, we'd have to put something in writing that would say, for example, although he has wages, he's only getting this amount of food stamps, the combination of his income is not enough to support his specialized diet, and the specialized diet requires.
Like you said, there's a cap on this, so it's hard to even figure out. I don't know if I would, right now we're losing money in a lot of places because we're not using like transportation and stuff. That money, it's just waste, whatever. But that's a whole, that's a whole different issue. But sometimes, I've run out of money somewhere but it's hard to, like you said. What's the word? Divide it all up and figure out how much you're going to really use in different categories, right?
Yeah, I think that's the biggest challenge.
In the category. Right?
Yeah. And that's what I think the brokers and you guys would work on, is really looking at each line, because it's not a lot. And
right.
This is an advocacy point. If you ever have a chance to speak to someone or to advocate, is why not consider increasing this overall category limit? Because a lot of people find that they run out of money here. And there's so many good buckets here that are, can be utilized in a more flexible fashion. But then you end up working with your broker and saying, oh, I really need the personal use transportation, so I can't put in the clothing. And so, it's a lot of just making those decisions, what's going to make sense. And some families say, I don't want to have this tedious step where I'm doing staff activity fees, or I don't, with all the little receipts. So I'm just gonna, go for a big ticket item and or just do the reoccurring stuff like phone bills. Right. So it's really up to your preference, but.
Okay. All right. Thanks.
Okay. Mm-hmm. And then, and utilities would include, again, not cable, internet, those are already covered, but this would be for like your gas, electric, those kinds of expenses. Okay. And then the last two sections these are the ones that, offer more flexibility and more room for, interpretation, is other goods and services that increase independence and other goods and services related to health and safety. So I mentioned earlier about under the software Seize Alert app. Well, the Apple Watch itself that would work with that, has been something that's been submitted for under other goods and services related to health and safety, right? Because in order for that person to have the monitoring of the seizures, for that process to work and to notify family members for help, that's needed for health and safety, they need the watch. So that's an item that you would see there. And other goods and services that increase independence, like we've seen a lot of tablets, like in IDGS, you can't purchase hardware, but there's no limitation here anymore that we can see. So people have been using this line item for tablets or laptops, things like that. So these two are pretty flexible. So if when you're working with your team, if there's things that don't fit in any other category, you might want to look here and see, how that can be justified. Okay. And just there's some little asterisks here. So in general, landline, internet, clothing, utilities, and board stipend are not reimbursable for children under the age of 18, where the parents are responsible. And there might be exceptions granted by the DDRO office, but we need to, go through that process and submit a justification there. Okay, so for example, if if you have a child under 18 and you want to request for internet, you would have to demonstrate that you wouldn't use internet, as it says here, that you wouldn't use internet, but you need it for your child in order to access eViro, for example, right? So that would be an easy one. And remember, it doesn't say cell phone. So cell phone for children under 18 can be covered. It mentions here the landline, internet, clothing, utilities, and board stipend. Okay. And then there's a list of excluded items. Medical visits, co-pays, any expenses related to hospitalizations or nursing home stays, any illegal items or activities, cable TV, common household supplies, experimental treatments, repairs, activity fees for the individual that's being supported. As I mentioned, the ticket to the museum for your son or daughter would not be covered, but the staff would be covered. The expectation is that you would use their own income for those kinds of activity fees. Rental cars are excluded, vehicle purchases, legal fees, and any excess amount that's needed to pay towards rent. Okay, so this is that really wraps up the OTPS section. I just wanted to draw your attention to our website. Under services, we have the CFS self-directed supports tab, and this is where under goods and services justification forms, where we put we created 3 different forms, and two of them are under IDGS. But this OTPS justification form, it's an Adobe sign, so you or the broker can come in here, and we're just going to ask for you to respond to those 4 questions, that the tests that the state wants to look at. So what is the valued outcome? So what's the item or service? So I'm going to stick to the Apple Watch. So I would put Apple Watch here, and then the valued outcome. So what we're asking for is the date of the life plan and the valued outcome that's listed, because we just want to make sure that there's a linkage. And again, that can be in the life plan narrative. So it could be under health, let's say, that they need this app to notify family members when they're having seizure symptoms for health and safety reasons, so that help, so that help can be provided. So we put that here, and what page is that on? Okay, and then how does it increase the person's independence and or health and safety? So again, with the Apple Watch, would allow them to be independent when sleeping, or to be in the shower, for example, independently, because if they did have a seizure or started to display symptoms leading up to a seizure, the watch with the app would help to alert their natural supports or staff, right? That would be, I'm just giving an example using the watch. Okay, and then it's not an OTPS excluded item, so we just want you to go back to page 29 of the guidance to make sure that it's not one of those excluded items and not funded through any other source. So was any other funding pursued, and what was the result? So an Apple Watch is not something that Medicaid funds, and for me that would be sufficient to just make that statement. Okay, and you would sign it, it comes automatically to us, we would approve it, and we would then just put it in your file. So again, for things that you already have in the plan, we're not going to go backwards, but just moving forward, anything new, we would just want you to fill this out. Okay. And you know, I wanted to just, while I was looking through the guidance, just a few other things I thought would be helpful, just as a quick reminder. So family reimbursed respite. So for those people who are living at home with family members, you can request family reimbursed respite. And this is a very flexible category, which a lot of people have taken advantage of. This category also has a cap of $3,000 a year. This is 100% state funded as well. And this is designed to be used, for example, if you have an emergency and you want your next door neighbor to come and you know, spend 2 hours while you go take care of an emergency, and you would pay them, let's say you say I want to pay them $40 for the 2 hours, we would reimburse you. So we're not paying a respite person, we're not paying your neighbor directly, we're reimbursing you. You're laying out the money and then we're reimbursing you. Another a creative way people have used this category is maybe you want to hire somebody but you're not quite sure if it's going to be a good match, and before you put them through the whole process, you might have them spend a couple hours with your son or daughter, and they will then get paid by you, and you would submit that here. So there's a couple of different ways that people, or even if they've gone through the hiring process and it's pending. Okay. So again, we are reimbursing you directly. You know, there's no like tax liability for the employee. It's all I don't want to say off the books, but you know, we're not going to be issuing any kind of tax. We don't even want to know the person's name that's providing the help. That's between you guys. Also, another creative way people have used this is, you know, after school programs that maybe the YMCA has something going on. You might consider community classes, but you can also consider a program that might give you relief, anything that gives you relief. So maybe there's a drop-off center that's happening and you want to use the funds here. So anything that's giving you relief. Some people have used it even for camp. So the camp that's that, you know, maybe an extra week of camp and you can't get it funded through, maybe you've spent $4,000 in the camping area, and then you know, the additional amount of money for the following week, maybe you could use it here too. So it's very flexible. You want to just make sure that it's providing relief to you as the caregiver. Okay. If I go back to the portal, oh, I don't know what that's on my screen. That's interesting. If I go back to the portal here, there's a new option for you to submit under SDS if you go to Invoice. And actually, Jen, if you can drop in that form into the chat, the Word document. So we can take this in two ways. So you can go to submit a new invoice, and that you would do by hitting that plus button. Okay, and if you select family reimbursed respite, you're going to, you know, pay it to yourself. Again, we cannot pay the person, we have to pay the family member. You see where it says add services here? If you click, this is only in the last few months, I think. If you click add services here, the system allows you to enter the date and times. So if you want to tap into this, like let's say once in a while for a few hours, it's easy to probably just, you know, drop in the times here. So if you use this option where you're adding the services, we do not need an extra form, okay? If the form, like I've seen families take a vacation and they might bring somebody along with them, and they use that family reimbursed respite for good amount of hours, you're just going to do the same amount, where you're going to attach the form and put the amount there. So Jennifer will drop in the form into the chat.
Hey, Linda. So just to add to that, hi, everyone. So the FRR claim is there posted on the chat. So if you decide to add the FRR via the portal without the form, you have to do it within the month, because you're going to find that if you're looking to, let's say, now in August, enter all of the July family reimbursed opportunities, it's not going to let you. So you actually have to enter the services from within the month and make sure that you approve and sign off on all of them before the month ends.
Okay, because you're giving the dates, right? Is that why that is?
Right, because
Okay.
It asks you each date, right? So if you're going to enter August, you have to do it by, the 31st or, whatever the last day of this month is, or else September 1st, it won't let you go back.
Got it. Okay. So if you want to submit it in real time, and if it's just, one or two, lines, maybe using that ad services is a good thing. But if you only kind of get to doing this every so often, and using the form sounds like that would be a better option. That gives you more time to submit. Excellent. Okay. Okay. So again, that's flexible. Again, the goal here is to provide relief to the caregiver. And lastly, I wanted to just go over, very briefly, because I know there's been some discussion about it, is the hiring of family members. No, of course, I'm not going to find it. So OPWDD does allow the hiring of family members as long as they meet specific, here it is, specific criteria. So family members cannot be hired to provide live-in caregiver or paid neighbor. But if you want to hire a family member to provide ComHab or self-hired respite, you could do that as long as they're at least the age of 18. They're not the parent, legal guardian, spouse, or adult children, including son and daughter-in-law of the participant. The service is something that's not ordinarily performed by a family member, and the service is necessary and authorized and would otherwise be provided by another staff person, right? And the last thing is the relative cannot reside in the same home as the individual. So again, if you have a family member that you'd like to hire, this is on page 31 of the guidance document. These are the parameters here. So we do have a number of people that will hire, a sibling who's lives somewhere else, maybe even just to provide some relief. Obviously you have to make the best choice there, because we've also seen where sometimes that doesn't always work out so well. That's a little bit of a complicated situation, but that's definitely something that is available. Okay, so any questions on any of those three categories or areas that I went over? Okay, I did want to, again, I am not an expert on EVV, but I wanted to at least provide you with some updates. So electronic visit verification is something that in 2016, Congress passed the 21st Century Cures Act, and it requires all state Medicaid programs to implement an electronic visit verification system for personal care services and home care services. There was a period, it was supposed, again, this was passed in 2016. There was a waiver given that would extend the deadline for when states had to be in compliance with this. And that's already passed. So what I know of as of today is in New York State, as of January 1st of 2021, New York State is mandating this EVV process to be in place. New York State chose, so each state, and that's why I know you'll hear a lot of information about EVV, because different states were able to make decisions on the model that they wanted to choose. In New York State, they chose the choice model, which is the more flexible of the options, and that allows providers like us to engage a vendor that we feel comfortable with, as long as they meet compliance, as long as they're compliant with what the Department of Health is looking for. So we, as you know, we are using eViro. One of the reasons why we chose eViro also is because they are already EVV compliant. They've been following along with the state's requirements here, and they've set up their mobile application to be able to pinpoint. There's a few required elements that must be in place. So it's basically verifying the visit, verifying the staff's visit to supporting the session, right? So it's the date the service happened, the check-in, the check-out times, and the location, you know, and the staff's name and your son or daughter's name. So those elements have to be recorded in a system that gets shared with a Department of Health system, like a repository. I'm forgetting the name of what it's called, but like a clearinghouse that, you know, captures all of that. An interface, it's right here, an ICD. So an interface would happen between eViro or us and whatever entity the Department of Health comes up with, and the data then gets submitted prior to us billing. So let's say we bill right now for community rehabilitation and respite every 2 weeks. So starting January 1st, before we submit that billing and after the services have been delivered, we would upload a report through eViro to the Department of Health. They would take that data and they would put it into a central repository. Okay, just to be in compliance with this EVV. And so there was a lot of advocacy, and I was hoping one of the parents was going to be on the call today. I don't see that she's on yet, but there was a lot of advocacy from parent groups, a lot of discussion in the various listservs about, you know, against EVV, and the feeling was that, you know, you're tracking the staff and you know, because of that location element. So initially there was, you know, again, based on the model that the state's chosen, there was a lot of fear that the staff, while they're with your son or daughter, is going to be tracked. So that, you know, that's a privacy concern. And so a lot of, you know, a lot of advocacy groups have presented that concern to the state. And, you know, what is the need to have that information in a clearinghouse? Why do you need to have the locations? You know, it's more information than I want to share. So my understanding, I was on a call last week, and unfortunately it was a lot of information. There's a lot of technical information that they're sharing on these calls. And part of it, what I thought I heard was that the state no longer requires like the GPS coordinates. They just need the location to be identified as home or community. Which, if that's the case, and again, I'm waiting for something in writing that supports what I think I heard, but if that's the case, then that whole concern about privacy being shared, you know, should go away, because we already capture home and community when your staff are indicating their services. So it's, if that's the case, then I think that advocacy, the movement really worked. So I wanted to give you just a little overview. Again, I'm not an expert here. This is the New York State website for EVV. You could just Google New York State EVV and you'll see it pops up the first one. The Interagency Council, which is a provider association, also has a web page on their website that's dedicated to EVV, and I often go here for just to keep up to date on information. The timeline for the rollout of this, like I said, is January 1st. There's in October, there's going to be released some what that central clearinghouse entity is going to look like. And so providers like eVero are going to need to make sure they're properly set up to transmit that data to them in time for the January 1st go live. So eVero as an application, we've had some discussions about this. They, when your staff sign on to the app, they can choose to allow their GPS or not allow their GPS. We have told them they do not need to allow GPS at this time. And it would seem that they will not need to. Again, I need to just make sure I heard what I heard correctly. So if as long as that I heard that correctly, that they won't have to turn on the GPS, then that information is not going to be shared. But initially that was the thought, that we would have to force the staff to turn the GPS, we'd have to pinpoint the check-in and check-out locations, and we'd have to share that with the state. So, okay, so I'm going to, I'll share this document with you guys. So this is just the website. There's also a help mailbox if you have questions, or if you're still concerned about this and you want to send an email. This is the link to the Interagency Council site that I just showed you. I'm also going to drop into the chat this is an advocacy letter that some of the national organizations put together, just requesting CMS to further extend the rollout past January 1st due to the current pandemic. So I don't know if that's going to happen because we already did get an extension. But I just wanted to share that with you because I know advocacy is important. Everybody has their own opinion on this. It's my opinion that as long as they're not, requesting that GPS coordinates, I think you're okay as far as privacy. We already bill the Department of Health. They already have this data in order for us to draw down the Medicaid dollars. So it's just going into a central repository. The other thing, the reason that this is happening is for staff who work for multiple agencies. It's been thought that there might be some double dipping. I don't know. I think this is a low-hanging fruit. I don't know it's a big deal. But if your staff is working for one agency in billing time at the same time as they're working with your son or daughter, they're going to be able to compare against, take one employee and make sure that that employee is not doing crossing over time. Okay, I am sharing my screen, so I don't, let me see if I can pull the chat up. Okay, so you're okay. You want to?
Nothing on the
chat. Did I cover anything? Okay, great. Okay. Any questions about any questions on your mind about eVero or anything that I just talked about? Okay. There was another thing I wanted to just mention while I have your attention. I'm just dropping these documents I just showed you into the chat. Feel free to download it if you like. So I know a lot of you have been hearing about issues that providers are facing. So the pandemic has been difficult on all of you. It's been difficult on providers, and as people are slowly starting to resume some sort of normalcy, or maybe not yet, but as we're looking into the future, many providers are finding that, I'm sorry, that, let me just stop sharing my screen here so I can see you guys. Many providers are just finding increasingly financial difficulties are coming to the forefront. So organizations that run day programs and residential programs are facing significant cuts to funding. The retainer funding that was supporting agencies to maintain staff while families make the difficult decision on whether or not to return their loved one to day program, that retainer funds went away. So in addition, just, challenges to the revenue that took place over the past 6 months. So I'm going to email out a link to the CP of New York State has a really nice advocacy page on their website and has a couple of position letters that address some of these issues. Now, again, it's not directly related to self-direction. I see self-direction really growing. I don't see any targets, but I think overall to the infrastructure and the future, there's a lot of very healthy organizations that are facing significant financial challenges right now due to some of these upcoming cuts. And as the state has lost a lot of tax revenue, and the state is really kind of pinching their purse strings as well, and the federal government mandates are becoming more difficult. I always think it's important for families to share their stories and to let your elected officials know that pursuing any additional cuts for people with developmental disabilities is not a good thing. I'm also part of a work group that we meet every Monday, and it includes a variety of different stakeholders. There's like 25 of us. And we were able to engage one of the members who's a parent was able to engage an organization that does surveys and knows how to analyze data. And we're finalizing the survey itself, and I'll share it on the portal so that you all can get it. This particular survey is going to be a little bit different because it's going to ask you to share a story. So you might share a story about your experience during this pandemic, and it's going to ask you to think about something maybe good or something that wasn't so good. And once you share your narrative, it's going to point you to like a triangle. So you'll say how you felt about each one of the questions. And the point of this is to provide a survey that captures people's stories, and to take that data and to present it to OPWDD, and we would look at the results of that to see, do we see any themes? Are there any opportunities for smaller focus groups that we can then use this to help drive OPWDD as they're looking at different policy changes? So I took it as a sample, and I thought it was so different than just doing a rating score and answering questions that were prescribed. It really gave an opportunity for you to share everybody's unique circumstances and to help us to come up with something that might point the state in the right direction as they're making changes. Okay, and then Mr. Ludoff, did you want me to just talk a little bit about the day program request for units and that? So I was having a conversation through email about if in the self-hired budget, some of you have direct provider purchase services that are listed. So an example would be day habilitation. So day habilitation is not a self-directed service, but the state wants you to capture the amount of dollars that the day program is going to be billing and reduce that from the overall PRA. So if your son or daughter has a PRA of $100,000 and $20,000 of that is for day habilitation, the day hab program is going to be billing the way they always do, directly, and it's not going to be self-directed. But the day program is supposed to report to the FI, to us, on a monthly basis with how much funds did they use, what did they actually bill for. So if they, and this is to prevent them from exceeding that $20,000 as an example. We have a hard time getting that information from the providers. So I've been talking about providing a written agreement where we would put something more official in writing that we would send out to the agencies to say, this is the information that we're going to require. Mr. Ludoff was saying, well, this doesn't make sense. This is stupid. This is not something you guys should be spending your time worrying about, which we agree. And I think, again, that might be an advocacy point, but we have brought this up as fiscal intermediaries. We did bring this up in the past, and we said, listen, why are we reporting on something, or why are we holding on to this information when we're not the ones directly billing for it? And the state just felt like this was the only way that they could, that it can be monitored. So it's day habilitation. It's also like
Linda, is that the same as like what I always say, where Ryan has the Grace Foundation, the On Your Mark,
Yeah,
City Access, and you never know how much
right,
of it you have to put the amount in for the whole year, which this year we totally got right.
right.
Because they're using some of it on Zooms, but that's whatever. That's besides the point. But you never know how, and it was either you or Jennifer or Faye on one of my meetings 2 years ago said, no, we really can't, they don't give us that information.
Yeah, so we're supposed to have it,
right?
and yeah, it's and again, I think we're just a small team here trying to think this through, and the best case scenario, they would send it to us on a monthly basis. We would plug it into eVero because there is a place where we could plug it in, and you could track it properly. But since they don't need to do that, it doesn't necessarily happen. It would require us chasing them. So.
Well, Linda, you say they don't need to. At one point you said the OPWD requires the day provider.
Yes.
And then you said, so which is it?
Okay, so what I meant by that is it's true. And to be honest, OPWDD has a lot of regulations, and sometimes we just kind of ignore some of them because it's just too many things to follow up on. And this is one of them. They have program, or the respite providers that bill hourly respite, they can go ahead and bill. There's no system blocking them. When they go to submit their billing, something doesn't pop up that says, oh, wait a second, did you notify the FI? So they're allowed to go through their course of business. And to be honest, they're not as familiar with self-directed service. So unless they have a team that really knows, oh, okay, this particular person has a self-directed budget and we have to notify them every month of the units, it's not going to happen. And if we're not set up to chase them every month, it's not going to happen. So I think in the very least, what we try to do is capture this information when we're at the life plan reviews. So we might not get it every 6 months, every month, but at least every 6 months. But like I said, I think, this is bringing forth an issue that we do have to pay attention to because we are ultimately responsible for this according to OPWDD. So my thought is, and seeing what other FIs have done, is to write up an agreement that we force them to sign, and then maybe do just a monthly email, group email where we have all the providers on there that are in this situation that we just send out. We put on our calendar to send it out every month and hope for the best.
But is there somewhere in the OPWDD regulations that says the day hab provider or the direct purchase provider will supply this information to the FI?
I'm gonna look for it. I'm gonna look for that. Yeah.
I've also got CDNY involved in this. They concur that this information should be provided to the FI, and they have not yet approached OPWDD. And just if it is already a requirement that simply needs to be enforced, then I'd like to have that arrow in the quiver of CDNY when they go in to OPWDD. I don't want them walking in and say, you need to require this, and they say, well, we do require it.
Yeah, they do require it. It's just really what we're talking about is the feet on the ground, having it actually happen. And like I said, I think, the way I think about it is there might be the person that knows, honestly, the person that knows that an individual is in self-direction would be the care manager, because they would have the life plan that would say, these are all the services. Probably the good place to have this discussion is at a life plan meeting, but when there's so many staff changes, it becomes difficult. So we might have said, hey, you're supposed to give us the units, and then there's a staffing change, and then that information doesn't come, and we don't round back to them. So I think, Mr. Ludov, it's really just how do we technically get this done? And this is not just in this example. this is responsiveness to a lot of things. So we have care managers who don't send us life plans. We have care manager change, or we're chasing that down, or we have life plans that don't even list us as a service, which means that they haven't really communicated with the individual or family even in that case. So it's just a coordination problem when you have multiple providers, you have care managers, you have staffing changes. So I think all of that is why this kind of circumstance happens. So we're gonna work on it. I think we can put out this agreement to the providers. We could talk to the brokers and say, listen, let this be on something that's on your radar. And we could put some, hopefully we'll figure out a way to put some automated systems in place that can remind us to request this as well. But like I said, I think this is another example of it's problematic for you guys, especially if you have budgets that are tight and you want to know, like Denise, to your point, you want to know, are they underutilizing? So you might move that money somewhere else. It's more of a problem for the provider end if they exceed that amount of money because they're not authorized to do. So I think there's a couple of different, but if you're not.
The other thing is too, I thought that you have to put all the money that can be used for the entire session in, even if you know you could, forget the pandemic. If you know you're going to be away for 4 months and your child is not going to use all that time, you have to put that money into those lines. That's what we were told.
So you gave me an example of, let's say, Grace Foundation. That would be a Grace Foundation decision. So the provider what we would want in the self-hired budget is what's going to be utilized. So if you meet with Grace Foundation and say, listen, my son is going to be attending X amount of sessions per year because we take vacation for 2 weeks, then that's what should go in the budget. If they tell you, no, we need to list it all, that doesn't make sense.
I forget, because I thought it was for the 3 things he does. I mean, now it's working to our advantage because he has extra money and he's doing like extra Zooms with Grace. So, I mean, right now it's working to our advantage.
Right.
But sometimes.
I should point out that when Kellett joined HeartShare, they requested that we put in, I don't know how many days, a full 5-day week, and Kellett only goes 3 days. And we actually had to go back and forth several times to get them to accept the fact that we were only going to put in 144 days because that's all we intended to utilize.
Yeah. It's true. It's difficult.
All right.
Sorry, it also happens because some of the people at OPWD, they don't understand the different caveats of self-direction, so they're lumping it together with traditional services. So that's why they're forcing some people to put in 5 days when they're actually purchasing 2 or 3 days.
Yeah, it's difficult. Okay, so it's 12:58. Unfortunately, my husband has a meeting. So I have the 3 little kids. But it's always great to see you. Again, I'm going to post this recording on our